Hello everybody. Today we are going to start rickettsial diseases. Rickettsia is a group of heterogeneous, small, obligatory intracellular organisms. They are gram-negative bacilli. Now there are various classification of Rickettsia and the genera which are mainly causative to human beings are Rickettsia, Orientia, Alicia, Anaplasma, Rickettsia, and Coxella. So these are the genera which cause infectious diseases in humans. Now see the mode of transmission. Mode of transmission. They are transmitted mainly through the bite of mite, tick, flea, and lice. So, these organisms are this organism serves as a vector for Rickettsia. Now, some of these like Rickettsia typhi, Rickettsia provozeki, Rickettsia typhi, Rickettsia provozeki, and Coxella burnetii are highly infectious. Why they're infectious? Because they can survive outside the vector, means they can survive in the environment. They are obligatory intercellular, but this species, Rickettsia typhi, Rickettsia provozeki, and Coxella burnetii, can survive outside the vector. So they are highly infectious. Yeah. A single Coxella inhalation can cause pneumonitis in humans. So they are evenly used as a bioterrorism also. Mainly R. provozeki, R. rickettsii, R. typhi, R. typhi, and C. burnetii. C. burnetii. Only the C. burnetii can cause chronic infection in human beings, and C. provozeki can cause recurrent illness or recurrent infection. So, C. burnetii is the only organism that cause chronic illness in humans, and C. provozeki can cause is responsible for the recurrent infection, and it is known as Brill Zinsser disease. It is specifically known as Brill Zinsser disease. Brill Zinsser disease. Now let's see about incubation period. Incubation period. Incubation period. So incubation periods depends on the type of causative agents. It depends upon organism. Normally, it varies from 2 to 30 days. Now, the clinical features. Clinical features also depends upon organism, causative agent. But during the acute phase, in the early 3 to 5 days, we can see the common symptoms, common manifestation in all organism like fever, headache, myalgia, nausea, vomiting, cough. So this we can see in the 3 to 5 days of infection. In this period, there is a difficult to make any diagnosis because these features are common in various diseases. So at this period, it is difficult to diagnosis for rickettsial infection. After that, in the progressive phases, you can see macular or maculopapular rashes. Macular or maculopapular rashes. Scar. What is scar? You can see in this picture this black dead tissue. Dead scar is a dead tissue at the site of bite of tick or mite, known as scar. Next, pneumonitis and meningoencephalitis. This meningoencephalitis means it involves meninges as well as brain tissue. Now we'll see the order of clinical manifestations one by one. The symptoms develop one by one. The firstly, we can see the macular or maculopapular rashes. Macular or maculopapular rashes, followed by development of a scar. Development of a scar. It is that tissue at the site of tick or mite bite. It is followed by development of vesicular rashes. Development of vesicular rashes. After that, development of pneumonitis due to involvement of respiratory organs. Then the development of meningoencephalitis. Meningoencephalitis. And finally, it progresses to hypotension and multi-organ failure. Why? Due to sepsis, due to septicemia. This is known as toxic shock syndrome. So, why? Because of sepsis or septicemia, known as toxic shock syndrome. Now, laboratory diagnosis. Or simply say the diagnosis. Diagnosis is based upon the clinical features as well as serological studies, serological findings. So, serological findings include CBC. In CBC, we can observe thrombocytopenia, decreased platelet count. There may be normal or increased leukocyte, decreased or normal leukocyte. After that, LFT, liver function test, we can see the increased hepatic enzymes. There are five hepatic enzymes: AST, ALT, ALP, GGT, and bilirubin. So they are all increased. Okay, AST and ALT also known as SGOT and SGPT respectively. Now the third one you can perform is the serum electrolytes. You can observe a decrease in the level of sodium, that is hyponatremia. Hyponatremia, low level of sodium in blood. And the last, you can also perform the immunofluorescence. Check for the level of IgG and IgM antibodies. These are the laboratory findings. Now, the treatment. For the treatment, we do empirical therapy. And for the empirical as well as for the treatment, same drug is used, that is doxycycline. Doxycycline is the drug of choice for rickettsial infection. In pregnancy, we can use chloramphenicol, doxycycline 100 mg twice a day for 3 to 5 days. For pregnancy, in the case of pregnancy, we use chloramphenicol. So here, as the general knowledge of the rickettsial diseases, in the later lecture, we will study the named diseases